Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Now, in the previous lecture, we have discussed about the anatomy of the hip joint. Today, we are going to discuss, or we are going to learn about the anatomy of the popliteal fossa. Popliteal fossa is located on the back of the leg, posterior to the knee joint, and here you are seeing the shape of the popliteal fossa, and in this diagram you can appreciate that it looks like a diamond shape depression on the posterior part of the leg. Here is the, and you can now feel the popliteal fossa on your own leg on the back side. When you will palpate it, you will feel two tendons of the two muscles on the medial side and a strong tendon on the lateral side, upper in the lower part of the thigh. In the leg, these tendons cannot be felt, but in the lower part of the thigh, these can be felt, and you can feel two tendons here and one tendon here on the lateral side. So what we understand from this diagram is that it's a depression on the posterior part of the leg, at the posterior to the knee joint. It's a diamond shaped depression. Now in the next we see this diamond shape, and when the skin is removed, we see that on the lateral side we were feeling is actually the tendon of bicep femoris, long head, and on the medial side is the two tendons which you are feeling in your leg are, one is the semitendinosus and other is the semimembranosus, or the two tendons are different, but the main tendon is the semitendinosus, along with that is the, and the other are the tendons of gracilis, and from above the sartorius will also come on the medial side. But here is the semitendinosus and semimembranosus. In the lower part, when it is removed, we can see lateral head of the gastrocnemius muscle and medial head of the gastrocnemius muscle. So we can now also define the popliteal fossa as a diamond shaped depression in the posterior part of the leg, and we can also define the boundaries. In the above and lateral side, bicep femoris is above, and medial side is the semimembranosus, actual boundary as the semimembranosus. And in the lower down and on the lateral side is the lateral head of the gastrocnemius, on the medial side is the medial head of the gastrocnemius muscle. So here we again see the boundaries of the popliteal fossa. Here we see the biceps, long head, and here we see the semitendinosus and semimembranosus. Here is the lateral head of the gastrocnemius and medial head of the gastrocnemius muscle. So once you see this, you can define the boundaries yourself, and then it is confirmed here by that supralaterally biceps, supramedially semimembranosus reinforced by the semitendinosus, inframedially, infralaterally gastrocnemius. Now if I see also this diagram, I see that here is the posterior part of the knee joint. Above is this is the popliteal surface of femur, then is the knee joint capsule, below is the upper end of the tibia, and this. So this whole will form the floor of the popliteal fossa, that is the popliteal surface of femur, capsule of knee joint, fascia over the popliteus muscle will form the floor. And obviously, if you feel your own leg, you feel the skin, superficial fascia, cutaneous nerves, and deep fascia will be forming the roof of the popliteal fossa. Now, here, then now we go back again to this diagram or to this diagram. Now, for recalling purpose, self-assessment, draw this diagram on a plain paper and write down the boundaries of popliteal fossa, and then compare those what you have written on the paper by drawing this diagram and labeling it, then confirm by this, and then you will inshallah recall. If you are able to recall out, it means that you have understood about the popliteal fossa. So anytime you put your hand on the back of the knee joint and close your eyes, recall the things about what have you learned about the popliteal fossa. Inshallah, all the things will be recalled by you. What do you know about the popliteal fossa? Then draw any of these diagrams on the paper, label it, and then write down your finding. Inshallah, it will be permanently in your mind. So when we open the popliteal fossa, we see these structures which are lying inside. So red is the artery, blue is the vein, and yellow is the nerve. So red should be popliteal artery, this should be popliteal vein, and the nerve should be from coming above should be sciatic nerve, which is here. I am seeing that it is dividing into a medial one which is tibial nerve called, and a lateral one part which is common peroneal part. So I can understand. And this whole space will be filled by the fat. And within that fat should be lying the popliteal lymph nodes. So by seeing this diagram, I will draw this diagram and I will try to label it. Here additionally, for recalling purpose, if you see, here are the tendons which are located from medial to lateral or from posterior to anterior. One is this, number 1, number 2, number 3, number 4. So one should be here, one tendon should be of the semitendinosus, semimembranosus, other should be one should be of the gracilis, other should be semimembranous, semitendinosus, and one is this should be of the coming from above, and this should be of the sartorius muscle coming from the anterior compartment to the medial side of the leg. So we can recall the insertion of 4 tendons over the medial side of the condyle of tibia from anterior to posterior or posterior to anterior. So as you see this diagram, there are multiple lines are here, but they are not labeled. Try to label them yourself for the self-learning. So if you starts labeling, you label this muscle as semimembranous, this muscle as semitendinosus, then is the sartorius, then is the one muscle should be of gracilis tendon, which is not shown here. So you label this lateral medial head of gastrocnemius, lateral head of gastrocnemius, tibial nerve, popliteal vein, popliteal artery, biceps long head, biceps femoris, short head and long head, biceps femoris, and this should be on the lateral side, iliotibial tract. Try to label them, and this vein which is entering into the popliteal vein, it should be the small saphenous vein. So one of the way of self-learning is that Choose such diagrams and try to label them, then compare with the original diagram, and then look how correctly you have labeled these structures. And if you have wholly labeled these structures correctly, then you get 10 out of 10 or 100% number. So self-assess yourself by doing this practice at home. It will be very beneficial for you. Here the diagram again showing the contents of the popliteal fossa. So the deeper one is the popliteal artery and medial. Then is the popliteal vein. Then is the tibial nerve. Here is the common peroneal nerve, which is coming out of the sciatic nerve. Here is the two heads of the gastrocnemius. Here is semimembranosus, semitendinosus, and here is the biceps femoris. So we can now recall the contents, boundaries of the popliteal fossa by this diagram. And structure which is not labeled is this one. It should be the small saphenous vein entering into the popliteal vein. So, popliteal artery. As now recall that diagram in which the the femoral artery was entering into the adductor canal, and then it is coming out of adductor canal through adductor hiatus. At the lower border of popliteal fossa, it ends at the lower border, runs downward and laterally, deepest structure. That is why difficult to palpate in the obese persons. So here we see its beginning, and here it is ending. It is a continuation of femoral artery. As the other diagram we able to see, here we are able to see that here is the adductor hiatus, the femoral artery continuing, coming out of adductor hiatus, running on the posterior side of the knee joint within the popliteal fossa, and here is the popliteus muscle at the lower border of popliteus muscle. This is dividing into anterior tibial and the posterior tibial artery tibialis, posterior artery tibialis, anterior. It is piercing the interosseous membrane, entering into the anterior compartment. And in this diagram we can appreciate also the branches of the popliteal artery. Here is the superior medial genicular artery, superior lateral. Then in the inferior lateral, inferior medial. And here are the recurrent, here are the branches from the tibialis, recurrent tibialis posterior branches. And here at this level are the artery. Surreal means middle genicular artery. So all these arteries are also taking part in the anastomosis around the knee joint also. So here are the muscular branches given to the muscles, and its two terminal branches, that is the posterior tibial artery and anterior tibial artery. So we go back and see its relations. Anteriorly will be the popliteal surface of the femur, knee joint and popliteus muscle. Posteriorly, popliteal vein, tibial nerve, fascia, skin. The branches are the muscular and articular branches, and we have seen here the articular branches. This diagram I have chosen because to show laterally the deepest part of the artery. Here you see, if this is the posterior surface of the knee joint, here is the popliteal artery, which is the deepest structure. Anterior to it is the vein, and then anterior to it is the nerve, tibial nerve. So for posterior to anterior, here you can see tibial, popliteal artery, popliteal vein, and this is the tibial nerve. So in this order they are lying. So artery is the deepest structure near the knee joint, near the capsule of the knee joint. Here, one of the purpose of this artery to lie here is to save the artery, and but the danger is that when during the injury of the knee joint, this artery can easily be damaged. So, what we have seen, this contents now are the popliteal lymph nodes. Popliteal lymph nodes, these are just under the deep fascia but in the fatty connective tissue close to the popliteal vessel, drain deep tissues of the leg, foot and knee joint. So these lymph nodes, they are comparable to the antebrachial lymph nodes in the cubital fossa, but here these are more enlarged and concerned with the drainage of the deep tissues of the leg, foot and knee joint, and these afferent, they go to the deep inguinal lymph nodes. Efferent will come, these are the afferents coming from deep tissues of the leg, foot and knee joint. Efferents will go to the deep inguinal lymph node. So we have learned about the popliteal artery, popliteal lymph node. Now is the popliteal vein. So popliteal veins is located behind, more superficial than the artery, along the popliteal, but carries blood from the knee joint, muscles of the thigh, calf muscles. They are carried by this popliteal vein. This popliteal vein should be formed by posterior tibial vein and anterior tibial vein. When they are joining together, they will form the popliteal vein. So it will also drain the peroneal veins from the lateral sides and turns into femoral vein when leaving the adductor canal. So there it becomes the femoral vein. Here it is the tributaries of the popliteal vein. The popliteal artery extends from the popliteal. That's about the popliteal artery. But one of the most important tributary of the popliteal vein is small saphenous vein. So union of veiny commitants of anterior and posterior tibial arteries at the lower border of popliteal fossa continues as femoral vein at the adductor opening, and tributaries vein accompanying the arteries and small saphenous vein. And small saphenous vein entering into the popliteal vein. Here we can see the small saphenous vein. It is necessary to describe it here. Here it is piercing the deep fascia, entering into the popliteal vein. The small saphenous vein begins behind the lateral malleolus, running upward at the lateral marginal vein, ascends upward, cross it to reach the middle of the back of the leg, perforates the deep fascia here, and then it enters into the popliteal fossa to join the popliteal vein. Tributaries from the great saphenous vein also, lateral marginal vein, numerous tributaries from the back of the leg, superficial tributaries at the back of the leg, small saphenous vein. Now tibial nerve, it passes vertically in the fossa and then leaves between the two heads of the gastrocnemius into the posterior compartment of the leg. It will give muscular branching arising from the popliteal fossa, articular branches and cutaneous sural nerve. Sural nerve will be given by this tibial nerve, which will accompany the small saphenous vein. Now the common peroneal nerve, it is also branch of sciatic nerve, runs downwards and laterally medial to the biceps tendon. Here we can see medial to the biceps tendon, and disappears into the substance peroneus longus to lie on the neck of the fibula. On the neck, this is a danger area on the neck of the fibula. The branches: sural communicating nerve, lateral cutaneous nerve of calf, superior and inferior genicular nerves, and recurrent genicular nerve. These are the four branches of the common fibular or common peroneal nerve in the popliteal fossa. Now we have learned up to here about the popliteal fossa and popliteal veins have nerve, tibial nerve, and then is the anastomosis around the knee joint. Here is the diagram showing the anastomosis around the knee joint. It is important here to mention this, that following branches: descending branch of lateral circumflex femoral, descending genicle of femoral nerve, anterior tibial recurrent, 5 branches of the popliteal artery. So from above, descending branch of lateral circumflex femoral, and a descending genicular branch of femoral artery, and from below, from the anterior tibial recurrent, and 5 branches, 1, 2, 3, 4, 5 branches of the popliteal artery. Superior medial genicular, superior lateral genicular, inferior lateral medial, inferior lateral middle genicular, and here is the inferior medial. Here is the anterior recurrent, anterior tibial recurrent branch, and from above here is the descending branch of the lateral femoral circumflex artery, and a descending from the femoral artery, descending genicular artery. They are forming the anastomosis around the knee joint. So if anyhow during damage to the knee joint or fracture of lower end of the femur or upper end of the tibia, the tibial artery, the popliteal artery is damaged. So the blood supply to the distal part can be maintained through this anastomosis, which is between the femoral artery above and the tibial artery, anterior tibial artery below, which will through recurrent flow will supply also the posterior tibial artery. So here is the anastomosis around the tibial joint. Regarding the clinicals of this, so you can very well imagine that the clinicals are concerned with the artery. If there is blockage of artery, then it is helped through the anastomosis. And why this is prone to damage? Because it is very close to the posterior part of the knee joint. The nerve can be damaged, sciatic nerve can be damaged, tibial nerve can be common, peroneal nerve can be damaged. If the peroneal nerve is damaged here at the head of fibula, the foot drop will be the consequence, because it supplies by the D branch the anterior compartment. And here is if the posterior part is damaged, tibial nerve is damaged, it will damage the calf muscles and walking will not be possible because of damage to the muscle of the posterior compartment of the leg. And the popliteal, you can see the popliteus muscle, the tendon of which will be intra-articular, and we will see later on its role in the unlocking of the knee joint. And then we see the anastomosis around the knee joint. Small saphenous vein is a superficial vein which harvests the blood from the posterior part and as well as the anterior part of the. If there is damage to this, or there is damage to the perforators which joins it to the deep veins, then there will be varicose of the small saphenous vein. So this is about the popliteal fossa. Inshallah, next time we will discuss about the anterior compartment of the leg. Please, again, my request to the students is that you can, it's this era and this age, this 20th century, is we can facilitate you, but the knowledge is not limited now. It's very fast. You can consult any book. You can go to the net. There are Teach Me Anatomy, one of the website, which is, I think so, for the students. It's a very simply written and with the clinicals given. Teach Me Anatomy. If you will go to the Google and write down any part of the that is of the part of the anatomy of the lower limb, and write down, you can learn, you want to learn about the anterior compartment, and write down anterior compartment of the leg by the Teach Me Anatomy, then it will come into view. Teach Me Anatomy. In my opinion, that is very simply, and that is very helpful for the students to learn anatomy. It's very clear with the diagrams. You can use your own book for the diagram purpose, and it is always necessary to open it. And the point today, I have told you that there is a thing which is very well established. One is the self-assessment tool. In the process of learning, self-assessment tool. It's your own assessment about yourself. Choose any part of the diagram from the leg, try to reproduce, try to label it, try to reproduce as much as you know on a paper, compare it with the book, give yourself numbers, percentage of number, is it 100% okay, is it 50% okay, or 40% okay, and try to find out why you are unable to understand it, and then inshallah you will improve your learning. This is a very good method in these kind of circumstances when you are at home using nets only and you don't know how to recall, how to make interesting the things that you want to learn. And you can apply the anatomy on your own body, try to feel your body, try to perform the functions which you learn in the class, try to move the muscles and try to understand their actions. See you inshallah. Allah will help you. God bless all the persons. Ameen.